like that. Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself.
Good evening, my viewing audience. In with today's edition of Health Matters, I am your host, Shevaneé Nisbett, Senior Health Educator at the Health Promotion Unit. In with me today, I have Nurse Ermin Jeffers, who's the Coordinator of Community Nursing Services here on Nevis. Welcome, Nurse Jeffers.
Thank you very much, and good evening.
All right. So we're going to talk today about the Pap Smear Drive, the annual Pap Smear Drive that's being held in Nevis. And Nurse Jeffers is going to tell us a little about the Pap Smear Drive and what we can learn. We'll see what we can learn this evening. So Nurse Jeffers, let's start by you telling us what is a Pap Smear, or what does the word Pap Smear mean?
Well, a Pap smear is a preventive screening test for cancer. And this is done at all the health centers on Nevis.
All right. So what is the purpose of doing a Pap smear?
It's good to do a Pap smear because once abnormal cells are detected and treated early, persons have a 80% chance of beating cancer.
All right. So what is cervical cancer?
Cervical cancer, as the name implies, originates from the cervix. And this is abnormal cell growth in the cervix, and it sometimes spread to other parts of the body.
Okay. So tell us exactly where is the cervix located?
The cervix is located at the mouth of the uterus. This is at the lower end of the uterus. That's where the cervix is located.
All right. And what are some of the risk factors of cervical cancer?
Risk factors of cervical cancer are early childbirth, meaning having a baby at an early age, smoking, multiple sexual partners, impaired immune system, and also having sexual intercourse at an early age.
Oh. And what are some of the symptoms of cervical cancer?
Symptoms of cervical cancer include abnormal bleeding. You can have bleeding between periods, and also you can have bleeding after sexual intercourse.
And is it usually painful?
No, not in the early stages.
Okay, so the Pap Smear Drive is something that we are going to use, or the nursing services are using to prevent or detect early detection for cervical cancer. So tell us about the Pap Smear Outreach.
Okay, the Pap Smear Outreach, we're going to be having that on the 25th of January, which is Saturday, this coming Saturday. All the health centers will be open from 8 to 11 a.m. We have Charlestown Health Center. Nurse White will be at Charlestown Health Center. Brown Hill Health Center, we have Nurse Hill. Gingerland Health Center, Nurse Walters. Nurse David will be at Butler's Health Center. Nurse Simmons at Combermere Health Center, and Nurse Frederick at Cotton Ground Health Center. So all the health centers will be open where women can come in and have their Pap smears done.
And what time?
8 to 11 a.m.
All right. And how long does a Pap smear take?
Well, a Pap smear takes just about 5 minutes. No more than that, just about 5 minutes.
What is the procedure like? Tell us about the procedure.
Well, having a Pap smear, we have to have you lie on one of our beds here at the health center or coach, and then you have to be lying in a certain position where the nurse will be able to insert a speculum and view the cervix. She will then take a spatula or a brush and get some smear from the cervix, and then apply it to a slide, and that's it. it's done.
Is there any form of discomfort or pain being felt?
No pain. You might feel a little, discomfort, but it's not painful.
Nothing to talk about, right?
No.
Okay. So, how long has this been going on, the Pap Smear Outreach?
Well, we started the Pap Smear Outreach in 2017, so this is our fourth year. And the numbers have been increasing. In 2017, when we started, we had a total of 112 persons. In 2018, we had 130. 2019, we had 136.
Wow.
So we are also hoping that the numbers will increase this year, 2020.
Okay. That's good, and I wish you the best in terms of getting the numbers to increase.
Thank you very much.
In terms of getting your results back after you've had the screening, how long does that take?
I will say just about 3 to 4 weeks, your results will be back.
Okay. Who would you advise to come to the screening, and who would you advise not to come to the screening?
Okay, well, I must say that all women are at risk of cervical cancer. So I am inviting all women between the ages of 21 to 65 years to come out and have their screening done. And as long as you are sexually active, you're a teenager, you should come as well.
Okay. And what about if you are seeing your menstrual period?
Well, we don't expect persons to come if they are having their menstrual period. We usually advise that you wait until about 10 to 20 days after your menstrual flow to come and have your Pap smears done. And if you're going to be coming to have your Pap smear done as well, try not to have sexual intercourse for 48 hours prior to having the smear done. It's not a problem if you're having your menstrual flow, because of the fact the health centers are open on a weekly basis. We have each health center having a day for Pap smears. So even though we are doing this thing on Saturday, we are just doing this outreach, trying to accommodate persons who are not able to access the health center during the weekdays.
The weekly Pap smear schedule for the various health centers on the island are as follows: Charlestown Health Center on Fridays, Brownhill Health Center on Thursdays, Gingerland Health Center on Thursdays, Butler's Health Center on Thursdays, Combermere Health Center on Tuesdays, and the Cotton Ground Health Center on Mondays.
So even though we are having this Pap smear outreach on Saturday, you can still come in on weekdays and have your Pap smears done at any of the health centers. You just come in, ask the nurse when is their day for Pap smears, and then she will advise you.
I like that it's available and being offered throughout the week, throughout the year.
Yes.
That's really good. Okay, what have the numbers? So you said the numbers have been increasing so far. So in terms of detecting cancer for Nevis, have you had an increase in the number of positives detected?
Well, it's been basically like the same over the years, not a very large increase in the number of abnormal cells that were detected.
That's a good sign or a bad sign?
Well, it's good that we don't have a large increase of abnormal cells detected.
But it's good that you can be able to detect early.
Early, yes, because remember, like I said before, early detection saves lives.
Okay, and this screening is being offered all year round at the health centers. If someone prefers not to go to the health center for whatever the reason may be and they want to go to the doctor, is that service offered privately here?
Of course, yes, because we have some persons who don't really utilize the health centers for that. They prefer to go to their private doctors. We don't have a problem with that. Of course, they can do that to their gynecologist.
Okay. And well, you mentioned earlier that even teenagers who are sexually active, they should go. They can come and get the Pap smear done, right? Now, for those individuals that are under the age of 18, do they have to have a parent accompany them, or it's okay for them to come to the health center?
Well, yes, we will prefer if they have their parent accompanying them to the health center to have their pap smears done.
All right. And do you have any last words for about the Pap Smear Drive or for the viewing audience?
Well, like I said before, all women are at risk for cervical cancer. So I'm inviting all women to come on out on Saturday, 25th of January. All the health centers on Nevis will be open to accommodate you. Just come and have your pap smears done because, like we said before, early detection saves lives. And once there are abnormal cells and they are detected early, you have 80% chance of fighting the cancer.
I like that. Thank you, Nurse Jeffers. And there you have it. You heard about the Pap Smear Outreach that's being held on January the 25th, 2020. That's this coming Saturday. And it's being offered at all of the health centers on the island, all 6 health centers on the island, from the hours of 8 a.m. to 11 a.m. And we're encouraging all females, especially those from the age of 21 to
65.
21 to 65, to come and get tested at the health centers, whichever health center is close to you, or if you have a health center that you prefer to go to, try and get your screening done, because early detection does save lives. It's true. I would like to thank Nurse Jeffers for being here today to talk to us about the Pap Smear Outreach, and I encourage one and all to go, even husbands and boyfriends, sons. You can encourage your mother, your sister, your girlfriends, your wives to take part in this screening, because it's very important. And like Nurse Jeffers said, you have an 80% chance of fighting the cancer if you were to detect it early, so it doesn't hurt just to go and get screened. I'd like to thank you for viewing this evening. I'd like to thank Nurse Jeffers for being here. And the fruit of the week this week is pineapple. Pineapple is a very rich source of vitamin C. It's also tasty. So we'll have some pineapple this week. Thank you.